Hi guys, good morning. So, basig matinghala mo, lain kay kumustorya is because sakit gid ako ang gums sa my inner portion sa akong cheek. So, I can't really pronounce well the words. So, bear with me guys. Sakit jud kay siya. So, now let's discuss chapter 5 of your book, The Values, Ethics, and Advocacy. And I want you guys to learn from this topic and try to be familiarized with the concepts and terms mentioned in this chapter. Okay, so we nurses must able to decide, sakit ko akong gums, the morality of our own action as nurses. Because when we are working in a hospital, we are facing so much ethical conflicts, moral conflicts. Like for example, the doctor ordered for a do not resuscitate order, so we cannot resuscitate the patient anymore. Pero personally, conflict na siya sa ato ang moral values and moral principles. Diba? Parang sa ato ang mga sa atong beliefs, dili gyud na siya maayo na dili nato tabangan ng patients when they are in the bridge of death na. So somehow that's my example about moral conflicts, ethical conflicts when we are working as a nurse in a hospital. This chapter will explore the influences of values and the moral frameworks of the nursing practice. So guys, along the way sa atong lecture, you will be facing different terms and concepts, and I hope guys na makuha gyud ninyo ang unod or ang meaty portion sa atong discussion this morning. So I really hope so that you will allocate time to watch or even to listen to this lecture, because after this topic we will be having our first quiz for our second monthly exam. Values, by the way, are enduring beliefs or attitude about the worth of a person, object, idea, or action. Not all values are moral values. Okay? Dili tanan ang ato ang values nga naasa ato ang personal life are considered moral. So, ganyan. Dili po tanan moral values are our personal values. So parang dili tanan ato ang na kuha na values from our parents, from our ancestors are considered moral. So dili tanan. And people tend to organize values internally from least to most important, forming a value system. Now, beliefs is an opinion. And these are the interpretation or the conclusions that people accept as true. So you as an individual, or we as an individual, we do have different perception, we do have different belief. So di ba natin mga conflicts sa mga atong mga beliefs kasi lahi-lahi man ta pagka-nurture sa atong parents. So somehow imong beliefs is tama na siya, but my belief is that is not right actually. So magkaiba ta. So for example, this is one of the best examples sa belief. If I study hard, I will get good grades. So that's your belief nga kung mag-study jud kag maayo, you will get sufficient grades, enough for your perseverance. Now, when we're talking about a combination of belief and value, this is the example. Good grades are really important to me. So that's your value, right? Kasi imuha dyan na siyang gi-incorporate sa imong life. I must study hard to obtain it. So that is your belief. So that's the combination of the value and your belief. Now let's discuss attitudes. These are the mental positions or feelings towards a person, object, or idea. When we talk about attitude, that's how compassionate you are. That's how you communicate with your patients, with your colleagues, and with your friends. That's your attitudes. And often judged as good or bad, positive or negative. So we as a person, we do have individualized attitude. So that's a matter of how we are being nurtured by our parents. Now, I want you guys to be familiar with these 5 essentials nursing values. So I want you to, as much as possible, if you are the type of person who forgetful, who tend to forget things, you really have to take down notes on this. The first one would be altruism. When we say altruism, it is also called as altruistic value system. So, katayon ako sa inyo guys, I'm really having hard time pronouncing words kasi sakit kaya akong inner cheek, sa gums, sa sulod. It concerns of the welfare of the clients and other healthcare providers. So you're just expressing how concerned you are. You are not just a passive healthcare professional. You are an active collaborator. You genuinely cared with your patient. Dili lang ka nagtrabaho lang ka just because of the benefits. You're just working because of the remuneration. Not just like that. You're working because you have the compassionate heart to care for those people who are sick and deprived. And the next one would be autonomy. The first one is altruism. The second one is autonomy. It's the right of self-determination. So nurse respect clients' rights to make decisions. So autonomy, guys, is a process wherein we are allowing our client, our patient, to speak for themselves, to create decision for themselves. So we allow them to communicate with us what they really want for the treatment, like the procedures. So we allow them to decide on their own. So we have to encourage, we have to motivate our clients to decide for themselves. The third one is human dignity. We have to respect the uniqueness and the worth of individuals. So we are unique. So we do have different characteristic beliefs, nurturing patterns. So we have to make sure that we respect each other. The fourth one is integrity. Appropriate code of ethics. Appropriate code of ethics, nurse is honest, and ethical framework is acceptable. Like you committed a particular mistake, like it's a wrong medication, you really have to make sure it's part of being, it's an integral pattern, or it's integral commitment of yours to surrender yourself once you committed a particular mistake. So once mag-commit ka ng mamali ka, like for example, you have to report it right away sa imuhang senior nurse. Next would be social justice. Fair treatment regardless of economic status, race, and ethnicity. So, I know you heard a lot of mga, shall we say, heresies, or not just heresies, but somehow it is really true that some of the healthcare professionals are biased. Diba? But personally, I really don't want to be discriminated, because I also belong to a poorest sector of the community. That's why kapag nurse na mo pohon, bisag unsa pa na patan-aw yung pobre gyud kaay na yung patient, wala gyud ikalaban sa inyo, wala gyud kalaban-laban, no read no write, you really have to give them proper care. You have to give them the proper or give medication rightfully, so that ganyan. So you don't need to discriminate them, and you have to treat your patient fairly. Okay, now let's discuss values transmission. It is learned from the word transmission, so it's self-explanatory already. It's transmitted, learned through observation and experience. Example, if the parents display this honestly in dealing with others, the child will probably value honesty. Okay, so that's why if you have a small kid in your house, you have to make sure that you as a person nga kauban niya sa balay nag-display pod og something positive attitude, because somehow that particular kid or that particular child will be assimilated, or shall we say acculturated sa imuhang decision sa imong life, sa imong mga attitude pod. Nurses should be aware that some cultures value the help of folk healer than a physician. So that's values transmission as well. Kasi guys, some of our patients in a hospital, feeling nila mas maalam pa or mas naaghang pagkahibalo ang ilahang mga albularyo, ilang mananambal sa bukid, di ba? They don't actually believe the capacity or the ability of the doctors or the healthcare professional in general. So ganyan. So really have to respect it and try to gather more data about that. And then you relay it to your doctors or to the healthcare team. Personal values are internalization of some personal values, and it gives sense of individuality. So personal values that makes us unique, okay? Next would be values clarification. So what is values clarification? It is a process by which people identify, examine, and develop their own individual values. Promotes personal growth by fostering awareness, empathy, and insight. So there are three steps in valuing process. The first one is choosing or cognitive or the learning method. So there are three: choosing, prizing, and acting. When you say choosing, so among of the values that you have, nakuha nimo sa imong family, sa imong ancestors, sa imong friends, sa imong colleagues, naka-learn ka ana, because that's part of it. You choose what's your values. So once you choose what are those values that are acceptable and what are those not. So that's part of the cognitive function of our brain. The first one is prizing. When you say prizing, it's the affective. When you say affective, that includes your emotional part of you as a person is proud of the belief she has and obligated to participate. So that's it. That's the second step. So the first step is nagpili ka and then nag-participate. The second one. The third one is acting. The behavioral. Chosen beliefs are affirmed, incorporated, repeated consistently in one's life. So that's the portion nga imuha na siyang gi-incorporate sa imong activity of daily living. So that's choosing, which is the cognitive, prizing is the affective, acting is the behavioral, wherein you incorporate everything that you've learned. Okay, so that's it. So you please remember those steps in valuing process. Now let's discuss ethics and morality. The term ethics refer to the study of morality beliefs of certain groups, because guys, there are beliefs of certain medical professionals that are not acceptable to other a group of people. So ganyan. So we really have to make sure that we're able to gather sufficient data for that. And the expected standards of moral behavior of particular groups. When we say bioethics, from the word bio, is an ethics applied to human life or health, like euthanasia. Like, di ba? Are you familiar with euthanasia, guys? Euthanasia is the process wherein, for example, in the US, it's not applicable here in the Philippines. Euthanasia is like, if the patient of yours is suffering like comatose, bedridden already, suffering from cancer, terminally ill clients, some of their family wanted to like allow the patient to die, like do not let the patient suffer from pain. So usually mag-euthanasia sila, like tagaan lang siya og kanang meds or medication or somehow basta mga tambal just to facilitate the easy death. So that's it. But here in the Philippines, we're not doing that. So that's it. And abortions. Specifically, abortions here in the Philippines is not actually morally acceptable in the society. While in the other countries, in Western countries, most of the Western countries there are abortion is somehow acceptable for them. So that's it. Nursing ethics naman refers to the ethical issues occur in nursing practice. So there are that we have to follow when we are a nurse already. So we have to follow ethics in nursing. Morality usually refers to the private, personal standard of what is right and what is wrong. So remember, this is somehow the application. Remember, an action can be legal but not moral. Okay? Example, unsa man pasabot ana, pwede legal pero dili siya morally appropriate. Like example, DNR is legal. Of course, do not resuscitate order is legal here in the Philippines, both in the Philippines and in the US. But one could still question whether the act is moral, di ba? Somehow, kung ikaw, you have that morality sa imong sarili, although kabalo ka na it's legal because it's ordered by the physician, pero somehow na conflicting belief sa imong heart, sa imong mind, that somehow that is not actually right. So that's what an action can be legal but it's not moral. And the next one would be an action can be moral but illegal. Okay? When the client is not breathing, like for example, you are an ambulance escort nurse and then you notice that the client is not actually breathing anymore. So you instructed the driver to to speed up the car, for example. But that speeding of the car is illegal. Though it's morally acceptable for you to do that because you are trying to save the patient, but it's not legal in the community or in the society. So that's what I mean when there are conflicts between the two concepts, like the being legal and morality. So must distinguish between morality and religion. So, an ethical violation of undergoing blood transfusion. So, I know, correct me if I'm wrong, Jehovah Witnesses are one of the religions that prohibits the transfusion of blood. So, we have patients also, we had patient in the past na they refused receiving blood as being transfused to them because it's not actually kumbaga dili na mao ilang tinuuhan. They reject that point of view kana magpa-transfuse og blood. That somehow we allow the patient to do that. They have to sign the waiver, like they have to sign the refusal form, refuse blood transfusion, and you allow the patient and the witness to sign it. For us also as a sort of protection sa mga nurses and mga healthcare professionals. So moral development is the process of learning to tell the difference between right and wrong and learning what is ought and not ought to be done. So there are moral frameworks that somehow applicable in our different profession. That the first one would be consequence based or the teleological. This look to the consequence or the outcomes of what action, whether the action is right and wrong. Okay. Under consequence based is what we call utilitarianism. Views that as good act that brings the most good and the least harm to the greatest number of people. Okay. So, kung kanato pa ni istoryahan sa pagkabinasaya, kung outside healthcare, outside sa ato ang profession as a nurse, for example, mag-igaga mo, you're just a group of friends, somehow, let's say, 5 to 6 individuals sa isa ka group, and then out of 5 to 6, you want to buy ice cream. So, 5 out of 6, gusto nila for example, mango. But ang isa, gusto lang is, for example, sa pamelayan flavor sa ice cream. Like, lahi iyang gusto na flavors. Wala ko kabalo. And then, syempre, the concept of utilitarianism is that the greatest good of the number of people, the greatest number of the people must deserve or must receive that care. For example, sa ice cream, 5 gusto og mangga, so sila gyud ang matuman. So tagaan mo sila chance kay mas daghan man ang gusto. But in the healthcare, for example, ang government magtukod og sa hospital. So gitukod nila siya sa daghan nga tao. So for example here in city of Matig, allow nila na tukudan og dira nga specific area because that somehow will bring some of the people, the greatest number of people going to the hospital compared when they will going to put up the hospital in far-flung areas. So somehow some of the patients or some of the clients could not benefits to that institution. So that's why they preferred building a hospital near the metropolis or dool sa daghan nga tao because that somehow facilitate the healthcare system of the community. So that's it. So that's utilitarianism. Ginatan-aw nato kung unsa ang maayo sa daghan nga tao. Okay? Next would be principles-based or deontological theories. Involve logical and formal processes and emphasize the individual rights, duties, and obligation. For example, a nurse belief is not to lie. Okay? Mao niyang belief nga di gyud dapat siya mamakap. I practice gid niyang honesty all throughout sa iyang career. But she opted to tell to the dying patient even though she was instructed by the doctor not to do so. So, ang dying patient, ingon ng doctor na ayaw sa ingon ayaw sa ingon ingani, but since ang nurse is dili siya gusto mamakak, iyang sulti sa dying client, although wala siya dili i-allow sa doctor. That's principles based. Okay, the third one would be relationship based or caring theories. The first one is teleological, deontological. The third one is caring theories. It's trust, courage, generosity, commitment, somehow internal value, a need to nurture to maintain relationship. Okay, so application. So now let's proceed to application. Scenario. A frail, older adult has made it clear that he doesn't want any further surgery, but the family and surgeon insist. Okay? So, syempre, tigulang na ka, siguro naisip sa tigulang na dili na niya kaya mag-undergo ng surgery. It's because dili na kaya ang recovery, prone na sa infection or what. So, the three theories apply ani. The first one is consequence-based. The surgery will cause so much stress and he cannot survive anyway. So, we are looking the outcome of the surgery. So, isipon nato na, of course, the client cannot actually cannot actually survive because somehow due to the elderly age or due to the older age, somehow dili na kaya mag-survive. Okay? Now, let's talk about principles based. This violent patient autonomy. Remember, autonomy is patient's right of self-determination. So, the client has the right to decide for himself. So, that's principles based. Kung imuha siyang i-inline sa principle based, you allow the patient to do, you allow the patient to decide para sa iyang health. So, that's principle based. When you say caring based, I must try to explain to the family that patient needs support from them. Okay, that's caring based. You are using your compassionate heart, your commitment as a nurse to explain to the family that somehow you have to allow the patient to decide on their own. So that's the application of the three theories. Moral principles. So this is also one of the most highlighted topic this morning. So autonomy refers to the right to make one's decision or the right of the client to self-determination. Each client has the right to make decision for themselves. Disregarding client's symptoms is a violation of client's autonomy. You're working in a hospital from, for example, 226, your room 226, which is actually the pinakalayo na portion sa inyong room, sa inyong hospital. Nagreklamo dito ang folks nga naigibate ang patient. But you refuse to assess the patient, you violated the client's autonomy. So that's it. So kung wala nimo sila gipangutana, wa ka nag-assess sa ila, na-violate na daw nimo ang autonomy sa client. So clients should receive information, consent before undergoing a certain procedure or test, because they have the right to decide whether they were going to pursue that procedure or not. So that's why informed consent must be done prior undergoing surgery. Okay, next would be, the first one is autonomy, don't forget that term. Next would be non-maleficence. Okay, non-maleficence, take note sa spelling, duty to do no harm. When you say non-maleficence, it's do no harm. Okay, just put it in your mind. So it can be intentional or unintentional. Okay, nasa naghang na akong phone. Wait guys. It can be intentional harm or unintentional. Like for example, wala nimo gituyo medication. Instead of giving that medication to patient Silva, you gave it to patient Donato. So patient Donato develop a severe anaphylaxis reaction or severe allergic reaction. So what's happening? That's considered as under siya sa non-maleficence. It may be intentional, magituyo nimo, or wala ni magituyo. That's belong to do no harm. So beneficence is the third one, means doing good. Always remember, doing good may also cause harm. For example, you may instruct a client to do strenuous exercises to improve general health, but should not do if client is at risk of a heart attack. Okay? That it doesn't mean na you're doing health education to your client. It's already you're doing good for your client. But the first place, prior instructing your patient, you really have to make sure that you give or you have already done the assessment part. You have to assess the health background, health history of your client before giving certain instruction. Kasi naghatag ka, ingnan mo, pag-exercise there, oh, grabe, strain you super, and then client pala is na a cardiac problem. So that might lead to another problem. So, the fourth one, is justice. Of course, it's self-explanatory, referred as fairness. Nurses need to weigh the facts in order to divide her time justly among clients. So, fairness is also talking about how you allocate time for your patients. Like you're dealing 1:60 or 1:40. One nurse kalaban nimo is 40 patients. For your 8 hours of shift, you really have to make sure that you allocate time for them. Unless there is emergency cases or naay mga tabanguno na pasyente, of course, dili man pwede nga tagaan mo siya shorter span of time tong mga like tong mga tabangunon kana mga exemption. But normally case, you really have to allocate time for your patients specifically. The fifth one would be fidelity. Means to be faithful to agreements and promises. Like, yung ka, ma'am, balik lang ko, ma'am, ha, maghatag ko tambal nimo. That's fidelity. When you go back, that's considered as your moral frameworks or your values as a nurse. So, don't forget that, okay? As a sort of recall, autonomy, non-maleficence, beneficence, justice, fidelity, and the last one, I think this is the last, yeah. Veracity. Veracity is telling the truth. Should a nurse tell the client about his or her condition, although it may cause harm? Ingnon ba nimo imong client? Because according ni gitulo ni Miss sa una, veracity, I really have to tell the truth. Okay? Of course, yes. Since under siya sa ethical values of a nurse. But of course, you really have to make sure you are collaborating with the healthcare professional or you're collaborating with the doctor of the client. Okay? So, paabot ninyo sa actual field, makabalo mo saan pag-weigh. And then, loss of trust mean the nurse and the anxiety caused by not knowing the truth usually outweigh, di ba ito last tong veracity ha, outweigh any benefits derived from lying. So, di ba, kung dili po nimo tug-aran nimo clients about his or her condition, that may lead to anxiety, and that anxiety may lead to some complication or some problem, not just in physical aspect but also in emotional and psychological portion of. So, nurses must develop accountability and responsibility. Accountability means answerable to oneself and others for own actions. Okay, so you are accountable to that. Like, for example, na mali kag hatag tambal, you are accountable for that. You are liable as a nurse. And then responsibility refers to a specific accountability or liability associated with the performance of duties and particular role. Nursing Code of Ethics. So, a code of ethics is a formal statement of a group ideals and values. Nurses are responsible for being familiar with the code that governs his or her practice. Code of ethics have the following purposes. So, what are the purposes of Code of Ethics? So, inform the public about the minimum standards of the profession, provide a sign of profession's commitment, outline the major ethical consideration, provide ethical standards for professional behavior, and guide the profession in self-regulation. So, these are the Code of Ethics purposes, okay? When you became a nurse in the future, you will be guided with this Code of Ethics. And it will also provide nurses of the special responsibility they assume when caring sick. So this will guide us all throughout our practice as a nurse. Okay, so guys, don't forget the terms that mentioned in this lecture. The second part of the chapter 5 will be discussed after the slides. Okay, so make sure that you try to observe everything, every concepts and terms mentioned here, because that will serve as your foundation. Because when you say fundamentals, so when you say fundamentals of nursing, that's your foundation of your nursing career, foundation of your knowledge sa nursing. That would be all, guys. Thank you for listening and stay tuned for our next lecture.